Hi everyone, Dr. Jeff Banas, and I'm going to talk a little bit about shin splints. Now I'm not going to go into great detail about what actually shin splints are, because if you're watching this video, I'm sure you actually spend a great deal of time already researching on the home therapy remedies you could do with the shin splints. But I'm going to talk about how to finally cure the shin splints. Now we know the shin splints are generally caused by one of two things. They're either increased tension of that muscle, or the muscle is really tight and it's pulling at that attachment where the tendons attach into the bones, or it's caused by an imbalance from one side of the shin to the other side of the shin, or the lateral shin to the more medial type of shin. And contrary to what you might actually read about, they talk about majority of the shin splints having on the outside of the shin. But in my experience, I see a lot more shin splints more on the medial or on the inside of the shin. And the reason you're probably still suffering from the shin splints is because you haven't addressed either of the imbalances. Like I said, it's either caused an imbalance of strength in the lower leg, or it's caused by increased tension. And what most places will tell you to do if you have shin splints is stretch them. But if one of the causes of the shin splints is an increased tension of that muscle and the tendon attaching to that bone, well, why would you want to stretch that and even create even more tension? That's just going to pull more at that attachment. And that's what you're doing if you're constantly stretching, the back of your leg, or constantly trying to really stretch that area. And so you're probably actually aggravating that. And then most people so don't need to be stretching that. So if we don't need to stretch that, how do we relieve the tension? Well, now you'll read about foam rolling and massaging the shin and doing some trigger point therapy on yourself. And yes, that will work, but I think there's a place for that. I personally think you get rid of the shin splints much faster is having someone else go in there specifically, get in there really deep and breaking up those trigger points. Also, another thing that we use a lot is a thing called dry needling. And a sports chiropractor could do this, or some physical therapists could do this. And it's not necessarily acupuncture, but what you could do is you could take the acupuncture needles and you'll find those trigger points. So if you've done some work on yourself, you've felt around all over your leg, the back of your calf, and you feel those little knots, those little trigger points. And yes, you've been told to foam roll those out. But really, the foam roller isn't going to get deep enough and really break that trigger point up and reset that muscle and then allow it to relax. After someone has gone in there and physically broken that up, yes, now foam roller, stick work, self-myofascial stuff release tends to help keep that leg looser and less tension. So if you want to get rid of the shin splints fast, go look into dry needling, and that's where someone will go through and find those trigger points on your shin, all over on the outside of the shin, on the inside of the shin. You'll find that little knot, take an acupuncture needle, tap that acupuncture needle into the spine, and move that needle around, and it will cause that muscle to contract and release that trigger point. Doesn't hurt at all. They're very fine little needles. You just might feel a little twitch. After that, typically we'll go in and do some deep tissue and further break that trigger point up. Then that will relax that shin and therefore reduce the tension that it's having onto the bone. Now you could do your foam roll work. Now you could go ahead and do the foam roll type of stuff, because that muscle has been relaxed a little bit. And now you could do your self-myofascial release. So you could take your own thumbs, find those little knots in there, which hopefully are less now, do that. And that tends to help keep that muscle loose and relaxed. So honestly, in my opinion, if you're doing this, and you probably already have, this is why you're watching this video, you've already spent a ton of hours already on this type of thing. It just doesn't get as specific enough, it just doesn't get it deep enough as something like dry needling and trigger point therapy. There is a place for it after that has been done. Now, after that has been released, after you have released the trigger points in the area and reduced the tension, now is when you want to strengthen the area up. And you do that by walking around barefoot, doing squats, doing lunges, doing leg presses, but you need to loosen the stuff up first. Generally, in my opinion, what I've seen, if you spend a lot of time doing the strength training, but you haven't loosened and released that tension in that area, you do a lot of strength training without the results. So what you need to do first is loosen that area up by a dry needle and deep tissue in there. Then you need to strengthen imbalances, and you do that by barefoot walking, squats, lunges, leg press, calf press, stuff like that. So look for someone who does some dry needling and trigger point therapy combined. That will get rid of your shin splints fast.